Now let's switch over to the biomedical treatment of disorders. So this is the pharmaceutical drugs. This is going to be changing brain chemistry through the use of drugs. Lifestyle changes, because oftentimes those lifestyle changes will affect the brain chemistry as well. And so, this is about using drugs to help treat the psychological disorders. So a good rule of thumb when looking at these notes and following these notes along is when determining what a drug treats or how a disorder would be treated with drugs, you need to consider what the neurological cause and how to fix that. So for example, depression is because there's an undersupply of serotonin. So what would a drug do to address that issue? And fix that issue of an undersupply of serotonin. The first set of drugs we're going to talk about is the antipsychotic drugs. These are going to be used to treat psychotic disorders such as schizophrenia. And I've given you a list there of different types of drugs that are typically prescribed to patients when treating schizophrenia and other psychotic disorders. Please note that Zyprexa there blocks serotonin as well as dopamine. Most of the others are just blocking dopamine. So that's how it works. It's going to block the dopamine receptors. The antagonist, so we might need to do a quick reminder on what that is. And they're going to usually see results in 4 to 6 weeks. So it does take some time to build it up to start to see an improvement. So if we're blocking the dopamine receptors, that means they're producing too much dopamine, and this medication is going to reduce that. Side effects here is sluggishness, tics, and other involuntary movements. It's tardive dyskinesia. With this, basically it's going to be very similar to the shakiness that you see in Parkinson's disease. It's going to mimic a lot of symptoms out of Parkinson's disease, and it might also have some Tourette syndrome with the tics as well. There is also going to be the lowering of the white blood cell count, which is something that they do need to track, because it means that it will be harder for the individual to fight off infection as well as weight gain. The next set of drugs we're going to look at is AntiManic drugs. This is going to be used to treat bipolar disorder. The main one here that is used most frequently is lithium. So it works, usually effective in reducing the manic episodes or the manic activity that they have. They're usually going to see results within a week. So of course it means they're not going to get as high if you're reducing the manic activity. Side effects here, lithium is very powerful. It's a very powerful drug, so you have to be very careful to not reach those toxic levels. So it is usually used for a very temporary basis. It's not a real long-term solution to dealing with a bipolar or manic episodes. The next set of drugs we're going to talk about are the antidepressant drugs. These obviously are going to be treating depression, so low or an undersupply of serotonin. You have the SSRIs, which are Prozac, Zoloft, Selectra, Lexapro. You have SNRIs, which is Effexor and Cymbalta. And we will talk about just in a moment what SSRIs and SNRIs mean, how it works. So SSRIs only inhibit the reuptake of serotonin. So there's the selective serotonin reuptake inhibitors. So they are going to prevent the serotonin from being reuptake, like after it, it's going to continue to hang out there. The neuron's not going to reabsorb it. It's going to hang out there and fall back into those receptors on the next neuron to fire it again. Whereas in SNRIs are serotonin and norepinephrine. So they're going to prevent the serotonin and norepinephrine from being reabsorbed by the sending neuron. This usually sees results in 2 to 4 weeks. The side effects here is dryness of mouth, constipation, headaches, and weight gain. Now let's talk about the anti-anxiety drugs. So this is benzodiazepines like Librium, Valium, Avantin, Xanax. How it works here is you're going to reduce the intensity of the responses to stimuli that signal punishment and frustration. So you want to reduce the intensity, okay? Highlight and mark that somehow. In this case, usually see results within a week, used for a limited time period due to possible dependency issues. So all of these can be, they can become addicted to them and require more and more of them, which is not a good thing. These drugs are going to depress the central nervous system, so that's going to reduce the response, that automatic response to the stimuli. These are going to be used to treat anxiety disorders like OCD, general anxiety disorder, social phobias, panic attacks, those sorts of things. So side effects here that you will see with these anti-anxiety drugs is going to be drowsiness, reduced ability to concentrate, lethargy, being very lethargic, as well as a physical dependence. So now let's talk about ETC. These are electroconvulsive therapy. There's no real forms it's only going to be used to treat severe depression. So this is when other methods are not working. Basically, this is going to pass an electrical current through the brain via 2 electrodes placed on the scalp. And for some reason, it seems to reset the hypothalamus. Basically, you're going to results in a readjust the hormone levels out of the hypothalamus, and they're not sure if this is what helps symptoms of depression or not, but this is mood altering effects are immediate. So this current that seems to reset the hypothalamus, the effects are very, very quick, which is when you're treating a severe depression, that's very important. Of course, originally when they started doing electroconvulsive therapy, also known as kind of shock therapy, the results were not always real positive. Sometimes people had a lot of brain damage that resulted in that. So today's method of ETC is very small, and they limited an effect on the memory, because originally under electroshock therapy, like, memory would be wiped out. Yet much of the public still worries about the safety of ECT, just because of the history that's involved with this from when it was first introduced. And then a psychosurgery, which is used to be known as a lobotomy. So basically, you're going to go in and sever nerves between the frontal lobe and the centers of the inner brain structures. Originally, a lobotomy was they literally would drill a hole into the head through the front of the head and just kind of take out sections of the brain that way. The side effects here can be permanent, being permanently lethargic, immaturity, because you are, dealing with the decision-making center of the brain, and an impulsive personality might develop from this as well. All right, last thing real quick, I do want to touch on lifestyle changes that can happen and, that should be explored when you're looking to change the brain chemistry or deal with doing things to the central nervous system, because lifestyle can really play a major role here. So what we're talking about here is recreation, this is exercise, this is nutrition, this is relationships, and having relationships, either friends or some sort of social connection as well, because all of those do affect the brain chemistry and neurotransmitters that are getting released that can be very helpful and beneficial in treating various mental disorders, especially if it's being used in combination with either psychotherapies or biomedical therapies. So this is where that eclectic approach comes in, because not only are you going to be doing a psychotherapy and a biomedical therapy, but you also should be looking at the lifestyle changes as well. Okay, so this wraps up this set of notes over treatment of the 8th set of notes here. If you have any questions, let me know. Otherwise, don't do anything too stupid. Bye, guys.